Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. Delighted to be back with you on this beautiful, beautiful spring morning. But some things are more beautiful than others, as we're going to learn today about some of the difficulties with the pandemic and what it has meant to people as we talk with Moira Mulhern. Dr. Moira Mulhern, who is the director down at Turning Point. She's also the co-founder and chief executive officer. She's going to help us with resetting our happiness set point. That May is Mental Health Awareness Month, and we're going to spend a lot of time talking about the impact of COVID-19 on our mental health. So Dr. Mulhern is going to help us with that conversation. It's going to be a really, I think, an outstanding opportunity for us to talk a little bit about our mental health. But first, Hawkeye, my mental health wasn't as good this weekend as I watched the numbers rise.
Yeah, I'd just like to start with Hayes with just one active. So that's really good.
That's good
We should
news.
start off on a good foot.
That's good news.
The health system, not so good.
Yeah.
Just as you said. I think we were all watching that, all of us with the health system, looking at those numbers on a daily basis, knowing that I believe on Friday we had to go from one cohorting unit of COVID active infections to two. After we had been at one unit for so long, we had to kind of open up a new unit. Right now, we have 25 active infections, 7 in the ICU, but 6 of those are on the ventilator, so pretty severe disease. And then 13 in that recovery period as well, so 38 total.
Total of 38. Now, it's a far cry from the 200, 250 we had at one point, but it's also, unfortunately, a distance from the 7 acute we had for a while.
Digits.
To get back up there says we are clearly on the rise, and it's been a steady rise over the last week.
It has. Yeah, and that is in the face of probably really which started earlier before the restrictions got lifted. And we also know that people are not getting tested as much either. So again, the number of new cases that we see reported every day is not necessarily telling the whole story, but it's really going to be that hospitalizations, and we have seen our hospitalizations tick up for sure.
And as those numbers rise, it makes us concerned if they're the variant, if they're the standard. That's something I know we're trying to take a look at.
Yeah, and there are various outlets out there for recording that as well. It's just there's no one central area, and we aren't testing every isolate to see what the variant. But the variant, certainly the B117 or the UK variant, does look to be at least 50% or more of known isolates at this point in time. We also have a large proportion of the California variant as well. But yeah, just to your point, it was in Kansas itself.
Yes, yeah, so when you say 50% are variants as opposed to the wild strain or the original
or just
strain.
Other types.
Yeah, there are all sorts of variants, but a majority of those are the B117 variant, and that's in the state of Kansas. That's wastewater
correct.
And also looking at what's being tested in the lab. So we know that the rise in the variant and the rise in the numbers, we have to be very careful because we also know that the mask mandate went away in Johnson County.
Yeah, and we saw this before in other states. Those businesses in those other states were saying we still want it. It doesn't mean just because the mask mandate went away that the virus is gone, the infections are gone, the hospitalizations are gone. That's a separate issue. The virus is still out there, but we know the things that can protect us from further spread and from further disease, and that is continuing to mask, doing things outdoors instead of indoors, trying to distance as much as possible. And the most important thing, getting the vaccination.
Live long and prosper. Yep. We know that COVID is out there, and there's some recent discussion today about there was an article in the New York Times that came out about the lack of our ability to get to herd immunity because of the really slow increase in vaccination at this point. That's a concern because it just means COVID-19 is going to be with us for a long time. We don't want COVID-19 to tie you up. What we really want to do is make sure you stay vaccinated because that's the way to stay safe.
Yeah.
So today, let's first see if there are any questions from reporters that are out there. All right, not hearing any. So Moira, thank you for joining our program. We often start with our interviews and ask people, how has COVID-19 affected the folks you know, what you're doing in your work? And talk to us a little bit about what Turning Point is and what Turning Point does. First, how has COVID-19 affected you?
Well, when the pandemic hit, prior to the pandemic, we were seeing over 10,000 people a year and providing, 800 programs. And of course, that all stopped. And what we did is we pivoted to virtual programming and are now back up to, and within a couple of months, we're back up to the same level via virtual that we were doing in person. And so, and our participants love it. They think it's great. We will continue to do virtual programming when we open back up. And what we also discovered is that I started checking in with our participants because they're sick or the supporter of someone who's sick and they're already somewhat isolated. We checked in with them on how they were doing with the pandemic, and they were doing remarkably well. And they told us they were doing well because of the skills that they had learned at Turning Point on how to cope with, whatever life throws their way.
That, I think, opens up to have you talk to us a little bit about what Turning Point is. I know what it does. We send people from the health system from my clinic down to Turning Point. I know our cancer program is very supportive and is really integrally interwoven with Turning Point. Tell us a little bit about the history of Turning Point, because I believe as a co-founder, you're probably the right person to tell us about that.
Right, yeah, so Turning Point grew out of my work in the community. I kept seeing gaps in services, and one day decided to start an organization that filled those gaps in services. So we don't provide the traditional support groups because there were a lot of those, and we don't provide individual counseling because there's a lot of that out there. What we provide are time-limited, skills-based programs that teach people how to cope with whatever comes their way. And it's a particular resilience model that I'll show you guys in a little bit that is the underlying philosophy of all of our programs. So we started Turning Point in 2001 and grew and grew and grew, and then joined the health system in 2012. But we still continue to serve the entire community.
This Turning Point is a part of our health system. And one of the things you talked a little bit about is a happiness set point. So tell us what a happiness set point is and how can I get there?
Yeah, well, everybody has their own happiness set point. We know that from research. And what the researchers believe is that about 40 to 50% is probably hereditary temperament. And then the rest is really based on life circumstances and intentional activity. So the researchers in this area say your brain becomes what you attend to, and so you can change your happiness set point.
To do to get that set point a little bit better.
Yeah, so here's what I believe creates a happier, more optimistic life. And I think we have a slide showing the model of resilience. It's a resilience wheel. That is the model that is the underlying philosophy of all of our programs. So if you look at well-being in general, because happiness is part of well-being, if you look at well-being, there is a lot of decades of research on each one of these concepts here. And what we do at Turning Point is we make sure that we train some or all of those facets with every program that we do. And we know from our research that this model and learning these things and really training these facets within ourselves lowers anxiety, depression, and distress at a highly significant level. Because what it's really about when you look at happiness and you think about well-being, it really is about the skills that you have to recover quickly from whatever comes your way. So we all have a threshold of what we can handle before we start showing symptoms. And when I say showing symptoms, I mean physical symptoms or anxiety or depression or distress. And when we hit that threshold, if we don't have the skills to come back down, then we get in trouble, because what you're doing is you're bouncing around up there, hitting that threshold, and you will eventually either implode or explode. And imploding would be self-destructive behavior, and exploding would be violence, aggression, things like that, which of course we've been seeing. And when the pandemic hit, we saw a lot of people hit their threshold because this was new, it was stressful, they didn't know how to manage it. But if people start paying attention to these facets and start integrating ways to train these facets or strengthen these facets within themselves, then they will increase their threshold and will be able to handle more. And happiness is part of that. The more we can recover quickly and be able to quiet our bodies, quiet our minds, if we take good care of our bodies, if we know how to replenish ourselves, if you just look at that circle, if we can figure out what we're feeling, express it appropriately, take the edge off of perfectionism, all of those things, we're going to be happier.
Yeah, well, I think that those are wise words. Do you think that the pandemic has been harder, and I'm going to tell a story, has been harder on introverts than extroverts? So our church, Community Christian Church, we were back to kind of a soft opening last week. My wife's an elder there, and it was like we walked the church. We don't live too far. It's about a mile and a half. We walked down the church, beautiful day. And then I think every person she saw, she was just so happy to be back out and with others yesterday. And then as we walked back, she would run into people. And I, on the other hand, I'm a little bit more of an introvert or even an ambivert, kind of that mixture of both extrovert and introvert. But she just seemed to just blossom when being able to be back out around people. Do you think the pandemic has been harder on extroverts than introverts, or what are your thoughts around that?
Well, my personal opinion, I haven't studied it, but my observation has been, yes, it's been harder on extroverts than introverts.
Yeah, it's been difficult. So, okay, Hawkeye, we're gonna have to work on this happiness set point. We're gonna have to do better. What do you think?
Yeah, I think those points that she brings up are excellent, and I think a lot of it is kind of what you have for nature, meaning hereditary, but also part of that nurturing and what comes on. We know that different points, different times in your life, you have to have resilience. The pandemic has certainly proven to be a great trial for resilience. And again, it's not just one thing during the pandemic, it's a combination of those things. But it's very easy to see how there can be these continued or increased or exacerbated problems from individual to individual, but also as a community. And we have seen that.
Yeah, it has been a difficult time. It's muted even the best of optimism, but I think that we can see the light a little bit. We're clearly better than we were, although this recent rise does concern us. Jessica, let's get to questions from our community.
All right, so several people are asking this morning if we know if those who are hospitalized have been vaccinated.
Yeah, we went through that last week, and I can tell you by the end of last week, we know only one person out of the 15 or whatever the number was had actually been vaccinated, and they had not been fully vaccinated. And one of the problems you have to also remember is that if you have significant underlying health issues, let's say you're a transplant patient or you're on immunosuppressive drugs, you may not get as much immunity as most people will get from the vaccine, Hawk.
Yeah, and I think we can do a deep dive and try to get some of those more demographics, because I think that question is going to be coming up more and more.
Yeah.
Also, who is being admitted, what age groups, and why? Is it really for COVID? Because we still are doing the admission screening, where we screen everybody that comes in with a PCR, even if you're asymptomatic. So we'll try to get some of that. We'll work with the IPAC team. They've been very helpful in the past, and we'll try to.
And we know that even last week there were a number of people who were vaccinated and admitted for COVID, they're admitted for another cause, and they turned out to be COVID positive but asymptomatic. So again, we know that just because you've been vaccinated, it doesn't mean you don't get COVID. It just means you're not going to get really sick or die from it. But there's only one person hospitalized last week who was hospitalized for COVID who had been vaccinated, but they had just gotten their second shot. So they really hadn't gotten fully vaccinated yet.
Yeah, and I would also like to say it's also, and we've said this before, it's a function and it's a point of who we aren't seeing in the hospital, and that's those nursing home patients, especially those over 70. I think the person that was vaccinated was in their early or mid-60s. So we aren't seeing those patients, which is a good thing, but we certainly can try to get some more updated numbers.
And don't make that early 60 thing make you sound old anymore, right?
No,
We're not old in
not
the
at
early
all.
60s. Okay, other questions?
And how many of those patients are transfers versus from our area? Do we know?
Oh, I don't know the answer.
Yeah,
Let us
don't
take a
know.
look into that. That's not one of the things the variables we looked at.
Okay, so Isaac says he heard that a hospital in Houston is mandating its employees to get the shot. What are your thoughts on this?
Yeah, that's University of Texas Methodist, I think, and they were one of the first folks to go out and say we're going to mandate shots for everybody, and unless there's a clear exception. I think that our position has been that it's not an FDA-approved drug, so we haven't done that yet. We expect that the Pfizer Moderna folks will be getting their FDA approval next fall. So I think at that point we will have to reconsider that position. But and I think that's just an important question because it was under an early use authorization. Now, Texas Methodist is not the only hospital that's already taken this stance that everybody should be vaccinated, and we believe everybody in our team should be vaccinated. I think we're up to 87%
Yep.
of our employees are vaccinated, which is really, really good. And for comparison, we get about 97 or 98% of employees vaccinated for flu. There's only 1 or 2% who have maybe even fewer than that. I think last year, I recently heard there were 33 people who did not get the flu vaccination here last year. So not very many. So like maybe it's 98 or 99% of people are getting vaccinated for flu. So we're getting really close to that threshold. That'll be our goal. I do think for sure that once it becomes FDA approved, we'll be requiring it. And I think that's been the stance of most organizations I've talked to.
Yeah, and hopefully, again, we will continue to have those conversations. We know that other vaccines are mandated. These vaccines have proven to be safe, very efficacious. We know things like influenza vaccine, hepatitis A and B vaccines, those types of things are mandated in our facility, I think in a lot of facilities. So we'll continue to have those conversations.
Yeah, and I think, it's good news, too, that even though people were a little discouraged by the J&J question of clots, I've talked to a lot of people who want to get the J&J vaccine. It's interesting, which I'm glad to hear, because they're like, okay, 100,000 to 1 or 500,000 to 1, that's, those are really good. There's no medication that's in your cabinetry that's aspirin is not that safe.
No.
And so, if you look at it, I think you'd have to argue the J&J vaccine is extraordinarily safe, as are Pfizer and Moderna. I think people are attracted by the one-shot regimen, and they're attracted by the older technology that's in the J&J vaccine. So, which one is going to float your boat, doesn't matter. I'm not concerned. I just want to make sure that everybody gets vaccinated.
Yeah, absolutely.
Donna from Channel 9 has a question for Moira. What about introverts who are wary of getting back to normal and the stress that can come on from, running kids around, going to games, having to socialize again?
That is a great question, Moira. What do you think?
Yeah, that is a good question. I have actually talked to some people that are worried about getting back out there, and I think getting the facts and looking at the science and focusing on that part of it, as far as it's safe to get out there, and it's not just introverts that are worried about getting out there. It's people who have a higher anxiety level that are more worried about getting out there. So what I would do is talk to them about just first learning how to lower their anxiety level, and then looking at the facts and making their decisions.
Yeah, I do think that there are a lot of introverts that are going to struggle to get back out, and I think people with chronic disease are also going to struggle to get back out. That's obviously my practice with cystic fibrosis and lung transplant and other illnesses. But when you talk with folks, some of them are very concerned about being back out in public again for good reasons. They don't want to get sick, and some of the transplant recipients may not know exactly how good their immunity is, even after a 2-shot regimen like Pfizer and Moderna. So I think we have to be cautious about how we return and be thoughtful about folks. And remember, not everybody's in the same boat when it comes to safety. Not everybody's in the same boat when it comes to risk tolerance. And we have to give grace to people to respond in the way that they will best suit themselves.
Susan says she knows you've done this before, but a few other people were asking you to clarify about what we know about the possible boosters in the fall.
Yeah, so we don't know for sure what exactly is going to happen. You and I are, I think, speculating a little bit that we think there will be a booster. We think it's going to be sometime after a year of your initial vaccine, unless there's some other new variant that comes up in the meantime that the current vaccines are not effective against. So far, Pfizer, Moderna, J&J are showing good effectiveness against all the variants, including the one from South Africa, the
135.
Yeah, there we go.
351. Sorry.
But I think that your immunity will begin to wane at some point. That's a natural response to if you've been infected. Most diseases, especially viral illnesses, you tend to wane a little bit. So the booster reestablishes that immunity hawkeye, and I think probably what I'm reading is that it's going to be about a year out. That's what I was hearing from some of the ID experts recently.
Yeah, I mean, again, pure speculation. I believe you will continue to have a robust immune system from the vaccination for at least 12 months. We know that the vaccine, particularly mRNA vaccine companies, have pivoted to include that South African variant, the 351, just because that looks to be the most concerning as far as efficacy because of changes to the end of that spike protein that actually binds with the receptor on our human body. So we are expecting that. But what I would love in the future is maybe 2 or 3 or 4 different spike proteins that seem to be equatable with any of the other concerning variants that may be circulating at that time. We also know you will get some cross-reactivity from the spike from those areas that don't change at all. So I think overall you're going to continue to have immunity. Just as you said, so far what we know when we look at antibody levels, they do tend to drop down just naturally from infection. That's nothing new. But you have that potential to ramp up that immune system very quickly should you see that virus again. So I think we do expect it. I don't think we expect any boosters needed before a year, unless any circulating variants would dictate it at that time. But so.
Cindy says, once I'm fully vaccinated, I'd like to do some traveling within the U.S. What things should I do to minimize my risk? And should I be monitoring where virus levels are higher to determine where I travel to now that the vaccine is here? Will it matter?
Those are good questions. Hawk, what are your thoughts about that?
Yeah, I mean, I think that we've shown ways and we know how we can make things safe, and that is doing outdoors things instead of indoors is certainly safer. Still trying to keep your distance. We know, most importantly, that vaccination, but getting masking as well and doing those things, especially in indoor areas, is very important. It's really hard to say. I think you can look at areas of hotspots around the nation to see, should I go there, should I not? But if you're traveling to somewhere that is a significant tourist destination as well, that may not be as accurate because you have people influxing from all over the place. But we know that there are ways to make it safer.
But I think vaccination certainly plays a huge role with that.
Yeah.
Maura, what do you think? Travel has got to make people feel a little better. What are you thinking about folks who have restricted travel and restricted not going to do things that they know make them happy? If things are a little safer, you've been vaccinated, how do people step back into those things?
You know, I think they have to assess their own comfort level and make the decision based on that, because everybody's going to be different. I know people who are not going to travel until they believe it's completely gone, as you know, as much as it can be, and others that can't wait to get out and travel. So it's such an individual. It's such an individual decision, and really has a lot to do with your lifestyle and, again, your level of anxiety about the virus and about your health. And like you said before, Dr. Stites, you have to take into consideration any health conditions that you have. It's really interesting to watch the variation of what people believe and how worried they are about the virus. There are people that I've come in contact with that don't think they'll ever get it and aren't planning on getting the vaccine. And then there are others who are especially worried about it because of a health condition they might have or one of their loved ones might have.
Yeah,
So.
it is. It's a funny world. It's a funny time. Jess, what else?
Stacy asked, do you need to wait a certain time after getting the COVID vaccine before getting another vaccine like shingles?
I think, Hawkeye, we've said it's, just go get vaccinated.
Yeah, the guidance right now, just because there's a lack of data, is 2 weeks separating any one of those vaccines, whether you get another type of vaccine first and then COVID vaccine, or COVID vaccine first and then another type. The guidance is 2 weeks just because of lack of data. But we know, especially in my clinic, when I'm looking at somebody in a pre-transplant clinic for liver disease and liver transplant, I'm giving 2 and 3 vaccines at one time. So we know that with other vaccines you can do it and it's safe, but we have experience with that. Right now there's just lack of data. It's probably safe. We have given it. Certainly, I think, 1 day removed from another vaccine, but that was because we didn't realize it at the time. Overall, it should be safe, but the guidance is to separate those by that time period, just because of lack of data.
I'm thinking measles, mumps, rubella are all right there together, and I'm going to bet that in the fall we're going to be thinking influenza and COVID together and things like that.
I think so, yeah. That's certainly reasonable, because those are all, again, different types of vaccines. They aren't live virus vaccines. You did mention measles, mumps, and rubella together as one vaccination. So I think giving those as we move forward, I think you're exactly right.
Yeah, your arm may be a little sore, but it'll be all right.
Angela wants to know, when is it safe and effective to get the vaccine after you've had monoclonal antibody treatment?
Yeah, the guidance right now is 90 days. So that's pretty standard, and we have been continuing to abide by that guidance.
Yep.
Emily says, have you heard anything about people who have had COVID already only need one shot?
We have heard that because they have such a strong antibody level, and they really do. People who've already had COVID get that next shot of Pfizer, Moderna's the data I've looked at, and they have a really strong antibody response. People say, gosh, I really need the second antibody. We still recommend it, that we recognize that people who have had COVID, get their first shot, have a really high antibody level, and may have a higher level than people who've had 2 shots who didn't have COVID.
Yeah, again, the guidance is to go ahead and get your second shot, but just as you said, we know you can get a larger response compared to other people who did not get COVID after that dose. That is a question that is being actively investigated, so hopefully we'll have some answers from that. And again, we still don't know what the full correlate of infection of protection is from the antibody levels themselves, so that is another part to that answer that we are trying, or that question that we're trying to answer as well. So, but yes, it is being looked at with that one dose after natural infection.
Jennifer has a question for Moira. She said, if you're concerned about a loved one's mental health and well-being due to COVID, do some of these tools that Moira is talking about work, or when do I know I need to seek help and maybe go more in depth with their help, especially if suicide might be a concern?
Moira, what do you think?
Right. If suicide is a concern, then you definitely want to contact a mental health professional. And if they believe it's imminent, then you want to take them to an emergency room and have them assessed. But this model is really more for prevention of mental health crises. But even if you're in the middle of COVID and highly anxious or depressed, you can still learn these tools and they will help. We see that happen all the time. When people come to us at Turning Point, they're coming to us in distress because they've been diagnosed with a serious or a chronic illness. And we see that these skills lower that distress, that anxiety, that depression and distress. So if someone's just struggling, they can start learning the different techniques that are associated with these facets and feel better pretty quickly. But if it's as serious as feeling like they're have some suicide ideation, then I would definitely say.
And more, I would say if anybody is that worried about people, I just want to emphasize, help them get help. How do people do that? If you have a friend you're really worried about, you think, who do I call? Who should they call?
Well, there are suicide hotlines, there are behavioral health hotlines. I don't have those numbers handy, and that's really, I think the folks in our behavioral health department would be able to answer that question better than me as far as the specific routes to take.
I think it's the suicide hotlines are really important.
Yeah.
You can always call an emergency room. They'll give you some direction, but there are people available that will help give you direction if you're truly worried about someone. You don't want someone to languish out there whom you're really concerned about. And we know this pandemic has caused significant increases in the toll on mental health. And we've seen our own suicide hotlines rise exponentially, and especially early on in the pandemic, people were so afraid. And I think school kids and teenagers have been especially affected by this because of the loss of social contact. One of the drivers for getting schools reopened. So I think that those things we all have to realize they're still out there, and society isn't back to normal, and it's not going to really be back to normal. We're having a new normal. So stay in touch with your friends, stay in touch with each other's bubble, and remember there is the National Suicide Prevention Hotline or Lifeline that you can call that we've just put on the screen.
All right, so Kathy has a question about singing.
Oh yeah, I'm good at it.
Are you going to be
You ready?
singing?
Here we go. Take me home, Pat Mahomes.
I should
to
never
the
have brought it
place
up.
We belong. Beat
Okay.
Tampa Bay. We're coming for you. Tom Brady, you're going down. Go ahead.
Was that her question?
That was the
I don't-
question.
You
wanted
That's it.
him to sing?
She just wanted to get you singing this
Oh,
morning.
darn it.
Okay, so there's a real question. So she says, I'm 65, I'm fully vaccinated. She's missing her community choir. What is the best way to do this? Will it be safer in the fall, next spring, masked, distance, vaccinated? She said she knows it's an indoor activity, but her mental health needs choir.
That is a great question. So, Hawkeye, this is a hard one because we know that singing is one of the most
Yeah.
spreadable events that you can do because you sing, you project,
Yeah.
and you also have a few number of secretions. You're taking deep breaths, and it all goes out. Masking helps. A mass choir isn't quite the same as a live choir. I'm going to say a live or a
Right.
mass choir.
Yeah.
Our church choir has these section leaders. There's 4 of them with our choir director. They're about 20 feet apart, and they have masks on as they sing. So I think they feel safe. I feel safe about what they're doing.
Yeah.
I don't know. When do you think we're going to be able to get back to like a full-throated choir?
Yeah, I mean, I think it goes to kind of what you're doing, who you're with. I think it's going to be incumbent upon those organizations to really strongly encourage vaccination for those participants.
members, yeah.
Because we know it protects you against disease individually, and we also believe there is good signal that it also helps protect against transmission, and you don't transmit as much if you're vaccinated as well. But again, just as you said, it is one of those definitely higher risk activities.
Here's what I'm going to land on choirs, and I am a music lover, and it's what are my hobbies? Royals, Chiefs, fly fishing, and music.
Yeah.
And so, how do you do that? And I played the French horn for many years. I don't think that was too much of a threat to anyone. I wasn't very good, and my breath went all around the French horn.
Yeah.
And probably deposited
Not,
stuff
yep.
there. But I think that the key is going to be vaccination.
Yeah.
Right, because we know that vaccination decreases your ability to spread the infection. It decreases your viral load, which I think will result in a decreased risk of transmission. So even if you get it, your viral load's not as high. And so I think the evidence will be that once you achieve getting a lot of people vaccinated, and maybe even in your choir thinking about, do we need to require a vaccine before you can come back and sing in that group, keeps you safer. It keeps the people who are listening to you safer. And I think it makes the whole story a lot safer. Now, if you want to go out and mask, then I think that's a different story because masking helps keep people safer as well. Really drops the projection. We've proven that in the freezer a number of times. So I'd be more comfortable if people were vaccinated and masked. But at the very least, I would say to everybody, man, you better be vaccinated before you have a full-throated choir back.
Yeah, and that's to keep your choir members healthy.
And on your audience from having as much
Yeah.
risk. So, yeah, I think it's coming. I think you're going to have faith in vaccination, and initially probably faith in vaccination plus masking, but eventually I think it'll end up being vaccination, and I think that's going to turn out to be the key.
Debbie says, I know people who are planning a cruise in July. They are vaccinated. Ship patrons could be fully vaccinated. I don't think she knows. But what about each island they visit?
Oh my, that's a lot of questions to unpack. Okay, cruise ships.
Yeah.
We still don't know. I know the cruise lines are in deep financial trouble. They are clamoring to be back open. I think they view themselves as, gosh, if you can go to restaurants and society's opening up, why not a cruise ship? It is a contained environment, so you have to be careful. If there's a variant on board, it can spread, and if people aren't vaccinated, I think my logic is the same about the choir. If you're going to go on a cruise, be vaccinated, wear your mask. I think it's probably okay like that, and try and make sure you're distanced from people who are not inside your cruise bubble, if you will.
Yeah, and I think for the islands or for the stops, if you're on a cruise, you're probably only stopping for the day. So most of the time, if you're out there, you're probably just doing touring outdoors, which I think, again, is going to be much safer than doing anything indoors. So I think, but requiring vaccination would be a very good thing to do. I'd be concerned about other things on the cruise ship, diarrhea, illness, things like that. We know that norovirus and things like that very easily go around. So just need to protect yourself.
So I'd say be vaccinated, wear a mask. I think you can stay pretty safe.
Wash your hands.
Wash your hands, as make sure that you are doing the right thing around those rules of infection control, right? We tell you about all the time. They keep you safe wherever you go. And those rules include, wait for it, don't go out if you're sick, keep your distance, wear a mask, cough into your elbow, and V for vaccination, live long and prosper.
Okay, so according to a New York Times report, U.S. experts say the United States is unlikely to reach herd immunity because of vaccine hesitancy. Why is vaccination key in reaching herd immunity?
Yeah, we were kind of referencing that earlier today, but without vaccination, you're not going to get the herd immunity for a couple of reasons. First, even if you've been infected, your immunity does not last as long as it does with vaccination. Second of all, it doesn't protect you against all the variants. So vaccination becomes the key. For those who say, let's just go out and get everybody sick, unfortunately, that's not going to work, and you'll just spawn more variants by doing that. So the reality is that, as we've seen with polio, we saw with smallpox, you can control the risk of this infection if everybody's vaccinated.
Yeah, I think again, it's just simple numbers. The number of people that are susceptible to the infection and the disease spectrum is very important. If you take that number of people away and get that lower and lower by vaccination, you will then start to achieve population immunity a little bit quicker. But we also have to remember about the about half of the population, which we haven't talked about, and that's the pediatric population. We are all hoping and expecting that the vaccines will be emergency use authorized for that population, especially 12 to 16. Because right now 16 is the youngest age group, but certainly get those children vaccinated. That will help reduce the total number of susceptible people, and reduce the amount of people that could potentially spread the disease as well.
We know the good folks at Children's at Mercy have done a great job of working on trials in this area. I think they're really gearing up for having vaccination clinics for those 12 to 16, as we'll all be offering it as well. Should it be approved, and I'm going to expect good outcomes come the data come. I think we'll see it in July. So hopefully by then we'll be able to start getting kids vaccinated. That's going to be a critical part of our full recovery.
Yeah, and I think starting right now, it's very important. We heard stories last week about high school age people that one in particular that has a lot of cases. We are trying to give you, especially these young people, the ability to do things like they would normally, things like they were in 2019, not like 2020. So that's going to be coming up, proms, graduations. We know those things are being planned. Get the vaccine now, and then potentially save yourself from getting quarantined or having to be isolated during some of those important times that are coming up now at the end of the school year. So it's very important for high school age kids, everybody 16 and above, to be getting vaccinated at this point in time.
And we know it's prom season because it was Prom City at Loose Park on Saturday afternoon. Beautiful weather and a great weekend, and a lot of people getting ready to go to prom, and they were out getting pictures taken. So Prom City, Loose Park.
Vicki asked if we're seeing PTSD as a result of COVID. Also, do you think people who have a history of trauma, who suffer more from anxiety and other disorders like that, do you have any special advice for them, Moira?
Maura, what do you think? I'm guessing there's a lot of PTSD from COVID.
Yeah, so there is an increase in PTSD and and anxiety, obvious anxiety. A lot of the questions we've gotten today, even about getting back out there, are related more to someone's anxiety level rather than whether they're an introvert or an extrovert. And so, when you have high anxiety, if you are suffering from PTSD, then what you have to do is go get help. The things that I'm talking about today and that resilience wheel, those are really great things to do if you can find a class like we have at Turning Point, and we do it within the health system for the employees. But individual therapy is definitely warranted if you have PTSD. But I think the key to this, of all of these things that we're talking about, is really someone's anxiety level, and do they have the skills to lower that anxiety level? And one of the very first, most basic skills is your ability to self-calm. So learning different self-calming techniques is very helpful. But if the anxiety is really high, if there's PTSD, you want to get help via a therapist.
I have one more question for Moira.
Let's do it.
Who makes up the 10,000 people a year that Turning Point serves? How does someone qualify and sign up for Turning Point?
Yeah, so it's anyone who has a serious or chronic physical illness. So cancer patients, people with diabetes, autoimmune diseases, even arthritis, or if you are the supporter of someone with an illness. And we do go out into the community and provide programs for companies and other organizations upon request. But to qualify for Turning Point, That's it. And the programs are free. And I mean, we don't charge insurance. They are free of charge. We are supported by philanthropy.
It's a great
Yeah.
organization. For those of you
Yeah.
who don't know a lot about Turning Point, this has been, I think, a revolutionary group here in this city who's done just amazing work. Maura, how do people reach out and contact you?
Well, you can find us on the hospital website and search Turning Point, or go to turningpointkc.org. You can find us through that. You can call there's the phone number there and our website. You can get a lot of information, but give us a call.
Now, I bet if you Google Turning Point in Kansas City, you'll find you. Also,
Yeah.
where do they find the resilience wheel? Because that's a pretty cool thing.
Right. Physical, well, that is on our website. So you can look at it there. And we actually have something called Resilience Toolbox on our website. Doesn't have all 10 of those facets, but it has some lessons on there that can get you started. I have another slide on some things that you can do right now, start doing right now. And these are things that have actually been researched that boost happiness levels. And one of them is feeling reverence in nature. So getting outside, going for a hike, going for a walk, but really focusing on nature and what you're seeing and what you're feeling. Being around inspiring people is another thing that research has found boosts happiness. There is a really great meditation or exercise called loving kindness or compassion that has actually been studied quite a bit and has been studied in healthcare. There was a study done at the Max Planck Institute in Germany and was replicated here about how they lowered compassion fatigue and burnout rate significantly by using this meditation on a burn unit with the nurses. So you can Google loving kindness or compassion meditation. It comes up with the exercise. The easiest thing to do is to name 3 good things that happened today. What we know, and the neuroscientists who've been studying happiness and studying brain neuroplasticity, is that the brain is like a muscle, and if you're, it's like your bicep muscle, and you can sculpt your brain, that emotional part anyway, just as you would sculpt your bicep muscle. So if you practice by being grateful, so you can keep a gratitude journal, which is different than naming 3 good things, but name 3 good things that happened today. Sometimes it's hard to do, but we know that increases happiness. We also know that volunteering and giving is also another thing that increases happiness, the quality of your relationships. And there's some really great research on focusing on the activity that you are participating in, really focusing on that activity, which is basically mindfulness, increases happiness. And another way to train your brain is when you daydream about things that you love and appreciate, and it really works.
I got to tell you, my wife's going to be so mad. Everybody's going to be mad. I love to daydream, and I do it frequently. And so I'm usually fly fishing or doing something about, saving the world, whatever. And so I'm going to be daydreaming about this. Now I've got a perfect excuse, so that's great. Hey,
Sir, I can show you the research if you want to give it to her.
I'm going to go find that. Hey, tomorrow we have Dr. Carrie Weinicke, the chair of obstetrics and gynecology. She's back with us here in the studio to talk about issues related to COVID-19 and expectant moms. We still get a lot of questions about does the virus cause this or does the vaccine cause that? We're going to talk a lot about that and newer research information coming out about the benefits of vaccination, both for the unborn and the newborn children, as well as the expectant moms. So that'll be a really important discussion. Maura, final thoughts that you might have for us today?
I think that there's no escaping the human condition. Everybody has ups and downs and gets anxious or, has struggled with emotions. And I think that just focusing on those things that we talked about today will really make a difference in your level of well-being and happiness.
Well, we know the Turning Point has made a remarkable difference in the community, and thank you very much for being back on this, for being on our program. We need to get you back on our program because I think there are a lot of questions about people who are trying to find their way home. Hawkeye.
Yeah. We know that restrictions have been lifted, but that doesn't mean the virus is gone. We are actually seeing the opposite. We know the ways to protect each other. You can still do individually the right thing. Again, continue to mask when indoors in indoor settings. Don't meet in large groups. Doing things outdoors is much better. Continue to distance as much as you're able to. And of course, vaccination. We know that vaccination is the way out of this. Please talk to others who you know have not been vaccinated and encourage them to get the vaccine. We have plenty of spots available for vaccine here at the health system. You can go to either MyChart if you're a patient, go to the website, kansashealthsystem.com/vaccine, or call 913-588-1227. Please encourage vaccination for all those around you and in your bubbles.
Hey, and in just a moment, we're going to run a program about this being Melanoma Monday. And like other cancer screenings, too many skin cancers have gone undiagnosed during this pandemic. And as we close in just a moment, medical oncologist Gary Doolittle reminds us about looking for skin cancers. I want to encourage you to get a screening just to try and keep yourself safe and healthy. We've talked a lot about mental health and the intersection of COVID-19 and mental health. One of the things we have to do is to find our way home. How do we find our way home at the end of a pandemic that has been this difficult? Introvert, extrovert, ambivert, inivert. We all have to try to establish our new normal. We have to find our way home. And we've heard great advice today, and I invite you, if you have any questions, to go look up Turning Point, because they really do great work. Help yourself find your way home to where this new normal is, so you can make sure that you and your family and the people you care about are safe and everyone feels loved. We can choose anger, we can choose fear, we can choose hate, or we can find our way home and try and find the things that will keep us happy and healthy. And one of the best ways to do that is to be vaccinated. We appreciate Hawkeye's advice. We appreciate Moira. And we'll hear now from Dr. Gary Doolittle. And until tomorrow, remember, there is no place like home.
If you have a mole that evolves or changes, any mole that bleeds or itches, that's a sign that you should be evaluated. Those oftentimes present as just newer lesions on the skin, newer spots on the skin. They can be crusty, they can itch. The biggest risk times during the day are between 10 and noon, but also 10 to 4. So protect yourself. Sunblock, sun protective clothing, sunglasses, cap, hat. Just avoid that direct exposure. And when you are out, seek the shade if you can. I usually encourage patients to do what they normally do and enjoy outside activities, but protect yourself. The blonde, blue-eyed person is at greater risk. Red hair, blue-eyed again. Patients that have more than 50 moles, patients that have a family history of skin cancer, all are at greater risk. I think it's a common misunderstanding that if you're darker complected, you can't get burned, and that's not true. The American Academy of Dermatology recommends sunblock with an SPF of 30 or greater. The big issue with that is making sure you apply it thoroughly and often. Every 2 hours, and if you're in the water, it may be, even if you have, quote, water-resistant sunblock, it may be good for only 40 minutes. We know that barrier blocks like zinc oxide, also titanium dioxide, those are 2 agents that we know are safe. The others that are present in products in this country right now have been tested, and we know that the body can absorb them, but what we don't know is that that's harmful. The bottom line is, if there's any question about something new, get to your dermatologist or your primary care practitioner and point it out.